Sandy Marrero with Western Marketing. Western Marketing is a national independent marketing organization dedicated to recruiting services and supporting independent insurance agents in all 50 states. So today we are going to be working with Letty Perez, a broker account executive for Pivot Health. We're going to be talking about bridge to Medicare and how you can bridge that gap between the going from a short-term medical or ACA plan into a Medicare. So, Letty, are you there?
Yep, I'm here. Good morning, everyone.
Great. Good morning.
Let me know when you want me to get started.
Go ahead.
Well, good morning, everyone. As Sandy said, my name is Letty Perez. I'm the broker account executive designated for Western Marketing. And I wanted to thank you for taking the time out this morning to listen to the opportunities that you have available to you if you get contracted with Pivot Health under Western Marketing. So first off, I'm going to tell you a little bit about the company itself, just so you have an understanding. So who is Pivot Health? Just to be clear, Pivot Health is not the insurance company. We are actually a product development, marketing, and management company. We launched in 2016, and we're very proud to announce that in 2018, we were acquired by healthcare.com, which was ranked 583 on the 2019 INC 5000 fastest growing private companies. In the fourth quarter, which was the first operating quarter, Pivot Health sold 1,000 applications. And I'm very proud to say that we ended 2020 with over 54,000 new applications. So you see the great opportunities that we're offering. This is just a little visual to show you how Pivot Health is actually supported. So this visual is, we are a stool. Pivot Health designs the products and brings them to market. Then we have insurance benefit administrators. They are formerly known as Allied National. And I mentioned the names because you will see some communication from Allied or from insurance benefit administrators. They are our third-party administrators, so they handle our policies, underwriting, claims, and also commissions. Then we have insurance carrier partners that actually insure the products for us. And then we have networks and PBMs for our PPO networks and then our prescription coverage. So I'm going to go over the product suite for Pivot Health. So essentially, the Pivot Health market product suite is the under 65 market. So our niche products are going to be our short-term medical plans. We also offer a limited benefit plan, which is a zero deductible first dollar benefit plan. Then we have our dental and vision plan, and that's one of the only plan we have that can actually stay on for the client till after they turn 65. And then we have our supplemental, which is an accident, critical illness, hospital indemnity, and accident, death, and dismemberment plan that you can offer. The short-term medical products. This is our niche product. So I'm going to go over a little bit about what the Pivot Health short-term products have to offer. These plans are going to offer a large array of plan options that are bound to fit all of your clients' needs and budgets. The coverage can begin within 24 hours or as far out as 60 days. Extended duration options now available offer your clients up to 2 by 364-day plans or now 3 by 364-day plans. Some of the plans have access to some of the largest national networks. And then we have open access plans, which we use reference-based pricing to help reduce the out-of-pocket expense to your client. And I'll be going over reference-based pricing here in just a bit. Eligibility ages on the short-term plans for Pivot is going to be as young as 6 months of age, all the way up to 64 years and 11 months. And so essentially that means they can keep the coverage to the last day of the month prior to their 65th birthday month when they become Medicare eligible. We offer child and children only policies as young again as 6 months of age. Coverage for high school and college athletes is included in our short-term plans as well. And our plans are all backed by A-rated carriers. Our extended duration rules, and I'm going to go over this in a little bit, because with the uncertainty of the market now with the short-term plans, we're finding that our agents are securing their clients with coverage for up to 3 years where available. So we now have options to do up to 2 years or up to 3 years in most states, keeping in mind that the duration period, the maximum for the plans, are going to be 364 days. So 3 by 364 days technically. There's no new application in between each coverage period. When the first policy ends, the next one will start automatically. There's no gap in coverage, no new underwriting, no new waiting periods applied to subsequent policies. Then keep in mind, if a condition should develop while the insured is on the plan, that condition would not be deemed as a pre-existing condition in the subsequent policies. The copays and coverage maximums do start over. And keep in mind, the coverage maximums on the Pivot short-term plans are not a lifetime maximum. They are a coverage period maximum. Deductibles, coinsurance maximums also start over. And then the extended duration option must be selected at the time of enrollment for the general short-term plans. We currently have 5 different plan designs available for short-term. We have our core plans, which is a passive PPO plan. We have our classic plans, which are open access with no network restrictions. We have our newest short-term plan, which is the Epic plans that offer preventive and some wellness coverage. And then we have our quantum plans, which are a PPO plan utilizing a Cigna network. And then we have our Bridge to Medicare plan. Our Bridge to Medicare plan is designed specifically for that age band between 60 years and 64 and 11 months of age. I'm going to concentrate a little bit first on the pre-Medicare market and how Pivot Health has positioned ourselves to cover this particular market. So the strategy that we've come up with, we're providing products that take someone from that pre-Medicare all the way to Medicare. And we are committed to this market space, creating a value proposition that allows you to provide health insurance coverage for the entire household. So our Bridge to Medicare product is a 3 by 364 day short-term medical plan available for ages starting at the age of 60. And this is an automatic 3 by 364, unlike the extended durations that I just went over that needs to be selected at the time of enrollment. Then we have our short-term plans that offer 2 by 364 day plans, as well as 3 by 364 day plans. And those are available from 6 months of age all the way to 64 and 11 months of age. And then we are now offering a Medicare supplement plan for your Medicare eligible clients. So how does this Pivot Health pre-Medicare strategy help you as an agent? So this allows you to expand your product portfolio to decrease the lead acquisition costs. So it means you get to keep your clients from their pre-Medicare age all the way through Medicare. It increases your customer lifetime value. The Bridge to Medicare plan, we designed that specifically for that age band between the age of 60 and 64 and 11 months of age, if they're in good health and can qualify. The 3 by 364 STM plans are also available now in certain states. The Medicare supplement plans allows you to offer your clients that are now getting onto Medicare a supplemental plan that's underwritten through Pan American Life Insurance. And then we have our standalone dental plans that can be added to your clients' products for under 65, and they can keep it all the way through their Medicare years because there is no maximum age on the dental plan. So our Bridge to Medicare plan. So again, you have 3 plan options on these plans. These are going to be open access plans, so no network restriction. So your client will not have to worry about changing their provider if they're already established with a provider or a facility. It is going to offer some prescription drug coverage. And so some of the benefits for the Bridge to Medicare plans, it is an automatic 3x364-day plan. So it's up to 3 years of coverage with no additional underwriting for the subsequent policies. Again, if something should develop during their first or second coverage period while they're on the plan, that condition would continue to be a covered condition. These plans are available for eligible ages starting at 60 all the way to 64 and 11 months of age. So you ask, what if they sign up at 63? Well, if they signed up at 63, then they would not be able to ride out all 3 coverage periods because it does end at 64 and 11 months of age. These plans are open access plans, so there's no network restrictions. And the savings of 50% or more on health insurance costs every month compared to many of the other alternatives for this particular age band. And the footprint for the Bridge to Medicare plan is currently 10 states where it's available. Don't worry about memorizing it. You do have a state availability and duration chart in your agent portal, and as well on the quoting portal. When you click on the Bridge to Medicare tab, if it's not available, once you put in the zip code, it'll let you know that it is not available in that state, but it will give you other options that may be available to the client. So Pivot Health realized that the 60+ market really needed to be addressed, and that's why we came up with this strategy. So Pivot is invested in that 60+ market. More STM plans that are offering 3x364-day plans, the classic and core plans, and expanded states with 3x364-day plans available for eligible individuals between the age of 6 months and 64 and 11 months of age. The open network, no network restrictions, and national network plans available. And our short-term plans, including the Bridge to Medicare, are a great fit for the spouse that's not yet Medicare eligible, or maybe an early retiree, or a great COBRA alternative. So our statistics are in 2019, between the age of 60 and 64 of primary insureds grew by 63% from the prior year, 2018. And in 2020, we closed with 10% of our membership was the age band of 60 and up. Talking about the general short-term plans that we offer, the core plans are going to be a passive PPO plan utilizing the First Health Network. What I mean by passive is that if they go out of network, we will use reference-based pricing to help with the out-of-pocket expenses. And these plans are designed for those clients looking for everyday type coverage. You have office visit copays, $30 for a primary, $60 for an urgent care or a specialty doctor. It is limited to 3 visits per coverage period. You do have also some hospitalization benefits that are fixed or limited. So you want to make sure that the client is aware that there may be some out-of-pocket expense. For example, if they are confined to a hospital, the plan will cover up to $1,000 per day. Anything over that would be considered not covered. So for the core plans, you have low deductibles, you have doctor office copays available for each insured on the plan, access to the First Health Network. Again, if they go out of network, they will have benefits, and we will use the reference-based pricing. Prescription drug benefits on the Core 2000 plan includes copays. The limited and fixed hospitalization benefits I mentioned is what helps keep the premiums low on these plans. So the actual carrier for the core plans is going to be Companion Life Insurance Company. They are an A-rated company by AM Best. The candidates for the core plans are going to be the young, the invincible. We see mostly under the age of 35 on these plans, new entrepreneurs, and a lot of child or children only policies. Then we go to our classic category. Under this category, you're going to see there's going to be a lot of plan options that can help you customize the benefits based on what your client's needs or budgets are. You see there's deductibles ranging from $1,000 all the way up to $10,000. 2 plans that offer office visit copays, the Choice and the Deluxe. Again, it's going to be 3 visits per insured per coverage period. And then you've got 2 plans that will offer prescription coverage, which include copays, which would be the Deluxe and the Standard plan. The coinsurance maximum out-of-pockets range from $3,000 to $10,000. And keep in mind that that dollar amount does not include the deductible of the plan, so you do have to add that dollar amount. Maximum coverage on these plans range from $100,000 all the way up to $1 million. So you see here with the classic plans, there's a large array of plan designs to meet any of your client's needs or budgets. Plans that offer doctor office visit copays, plans that include prescription drug benefits with copays. Coinsurance max does not include the deductible, as I mentioned. These plans are open access plans, so we call them open network, no network restrictions, and of course we use the reference-based pricing with balance bill protection or balance bill guarantee, which I'm going to go over. These classic plans are underwritten by Companion Life Insurance Company. Again, they are A-rated. Candidates for these plans we see are normally over the age of 35, great alternative to an ACA plan if they don't receive a subsidy, and if they're healthy, self-employed, COBRA alternative, and again, that pre-Medicare age. So we see a lot of clients may opt to go onto one of these classic plans versus a bridge to Medicare where they have both options. So the reference-based pricing that I keep mentioning, essentially what this means is that Pivot will pay a provider up to 125% of Medicare allowable. And for a facility, we'll pay up to 150% of Medicare allowable for service in the specific area. Another term for the Medicare allowable is usual and customary charges. Now, keep in mind your client doesn't have to do anything special. They do receive an ID card, just like any other insurance when they enroll. That ID card provides the information on there for the provider or facility to call in and verify the benefits, as well as the instructions on how to file a claim. So the provider submits the claim to IBA for processing. That's Insurance Benefit Administrator, or TPA. And then the claims are going to be repriced according to that percentage of the Medicare allowable. The payment is then made to the provider. On average, we're seeing about a 68% discount from the retail charge. The member does receive an EOB, or an explanation of benefits, that'll show the discount amount. The balance bill protection essentially means that the member will not be responsible for a balance bill due to the discount taken. If they happen to receive a bill from the provider or the facility, they can send that bill into IBA for processing. We actually have a team that will go back and renegotiate with the provider or the facility, and if they can't come to terms, they will settle that payment, that balance bill, on behalf of the insured. Just a quick example to show you how this would work. So this example has a 59-year-old in Nebraska that required an MRI. The billed amount came in at $1,060. The Medicare allowable amount is $222.72 in that area. So with the reference-based pricing calculation at 150%, we would allow $334.08. Had she already met her deductible and was only meeting her coinsurance of 20%, she would have been responsible for $66.81. If her deductible had not yet been met, then she would have been responsible to pay the $334.08. And of course, that would go towards her deductible. So this is just an example to show you how rich of, how steep of a discount this really does provide the insured. Then we have our Epic plans. The Epic plans are going to have two different plan designs. The Epic PPO plan uses a Cigna PPO network. The Epic Base plan is an open access plan with no network restrictions. These plans offer 100% coinsurance. So once they meet the deductible selected on the plan, they would have met their maximum out of pocket. These plans offer free and unlimited telemedicine per insured per coverage period. And it also offers a preventive examination benefit after a 3-month wait of being on the plan. Some additional benefits offered on the Epic plans is going to be mental illness and substance use disorder benefits, as well as a supplemental accident rider that can be selected at the time of enrollment. And essentially, it will cover any expenses incurred for a covered accident up to the benefit amount selected. These plans also offer on this Epic PPO coverage if the insured happens to be traveling outside of the United States. And you also have an optional prescription drug benefit that can be selected with no deductibles. So the Epic plans are 100% coinsurance plans. So again, if they select a $5,000 deductible, that would be their max out of pocket. These plans include the free and unlimited telemedicine. They have the optional prescription drug benefit that will include copays with no deductible. The optional supplemental accident rider that needs to be selected at the time of enrollment with either a $5,000 or a $10,000 benefit. And again, the Epic plans offer two plan designs, the PPO plan that utilizes the Cigna network, or the Epic Base plan that is an open access plan with no network restrictions. The Epic plans are underwritten by North River Insurance Company. North River Insurance Company is an affiliate of Crum & Forster, and they are an A-rated company by AM Best. Now, keep in mind, in the states where the extended duration is offered, North River is limiting it to 2 by 364-day periods, where the companion life plans are offering a 3 by 364-day plan. And the candidates we're seeing on these plans currently are young families, as there are wellness and preventative benefits included, such as childhood immunizations covered at 100%, and then also the single and self-employed. Then we have our quantum plans. The quantum plans are a PPO plan that utilize the Cigna network. If they go out of network, we will use reference-based pricing to reduce those out-of-pocket expenses to the insured. The Quantum PPO copay plan is going to offer office visit copays for primary as well as a specialty or an urgent care. It is limited to 3 visits per coverage period per insured, and it is combined. The Quantum plan also includes a preventive health visit that'll cover up to $250 per insured per coverage period. And as you see, there's some wellness and preventative, such as a mammography and routine annual OBG. The Quantum PPO copay plan is also going to offer prescription coverage with copays and no deductible. Some of the additional benefits on the Quantum plan is going to be mental disorder and substance abuse benefits, as well as organ and tissue transplant if they use the Cigna transplant network. Also included in the Quantum plans is going to be an accidental supplemental benefit, and that does not need to be selected. It is included in every plan, as well as benefits if the insured is traveling outside of the United States and requires immediate medical attention. So a recap of our Quantum plans. The Quantum plan uses the Cigna PPO network, and reference-based pricing if they go out of network. The copay plan has doctor office visit copays as well as prescription drug copays. There are 100% coinsurance plans available if they happen to select a $10,000 deductible. And the maximum out of pocket on these plans is going to be $10,000. So if they do pick an 80/20 or a 70/30 coinsurance plan, their max out of pocket coinsurance max out of pocket does include the deductible in these plans, unlike the classic and the core. It does include the preventive office benefit up to $250 per person per coverage period. Also includes wellness and diagnostic benefits. The supplemental accident to cover the deductible is included in every plan. The quantum plans are also underwritten by Companion Life Insurance Company. And the candidates that we're seeing on these plans are families, Great Cobra alternative, again, an ACA alternative, and for those that are established entrepreneurs and don't have access to group or employer coverage. Our ancillary standalone and add-on products. So the Brilliant Dental Plan is available as an add-on product when selling a short-term plan, or it's available as a standalone plan. And keep in mind, the Brilliant Dental Plan is underwritten by Renaissance Dental, and the dental option comes with a vision option that can be added on. The vision is not available without the dental. This is a PPO plan. Eligibility ages for these plans are 18 and up. And when I say up, keep in mind, this is what I mentioned, for those that you're bridging from the under Medicare eligibility age to over Medicare age, these dental plans can stay with them till they're 100 if they continue to pay the premium. There's no waiting periods for benefits on these plans. The choice to start coverage any day of the month if you're selling it standalone. Now, if you sell it as an add-on product to a short-term plan, the effective date is going to coincide with the date selected for the short-term policy. Now, keep in mind, if you're selling a short-term plan to a family and there are children included, the children will have benefits. There are two plan designs. It's going to be the high plan and the low plan. The high plan does include child orthodontics, but these plans are not available for children only. Some benefits and annual maximums increase at the beginning of the first 3 coverage periods, so it is a progressive plan. Keep in mind, this is an insurance. This is not a discount program. Routine cleanings are paid at 100%. Basic services including fillings, sealants, and extractions. Major services including crowns, oral surgery, and implants. The vision portion is available through Vision Care, and there is going to be only one vision option to add on. Then we have our Latitude Supplemental Plan. So this plan was originally only available as a standalone product. Over the last year and a half, we added it on as a check the box. And of course, the sales increased dramatically because a lot of times you as an agent get sidetracked and forget to offer this additional coverage. This is essentially a bundled accident, critical illness, accident, death, and dismemberment, and hospital indemnity. These plans are very important to help with those out-of-pocket expenses in the case of one of these situations. The Latitude plan is the only guaranteed issue plan that we have. If you're selling it standalone, you'll see that there's going to be no medical history questions asked, and Social Security number is not required on these plans either. These cash benefits are paid directly to the insured. And coming soon, we are going to be adding some additional benefits, so make sure that you pay attention to any communications that you receive from Pivot Health. We have an Elite Limited Benefit Health Insurance Plan. This is our zero deductible or no coinsurance plan, first dollar benefit. These plans, there's going to be 5 plan options to select from where available. And some of the benefits, for example, a daily inpatient benefit can be as high as $3,000 for sickness, $6,000 for an injury, a day for 365 days a calendar year. The ICU benefits can be as high as $6,000 for a sickness, $12,000 for an injury, a day up to 30 days. A $5,000 or a $10,000 critical illness coverage is included for invasive cancer, stroke, heart attack, and end-stage kidney failure. A $10,000 accidental death and a $20,000 common carrier life insurance benefit is included in the plans. Wellness can be as high as up to $125 for a one-time wellness visit per calendar year per insured. Additional benefits included in these plans for fractures, dislocations, burns, and more. For those of you who are familiar with selling a limited benefit plan, there is a verification process that needs to be completed. We've recently streamlined our verification process where you can actually, as the agent, call in to the verification department with your client on the line and go through a short script that we've designed for them to answer the questions so that the policy can be issued. For those of you who have recently gotten contracted or plan on getting contracted with Pivot Health, you get a welcome email that provides you with your Pivot agent ID number or your writing number. And you would go to www.pivothealth.com, go to the login tab and the drop down to for agents. You'll use your agent ID number as your user ID and you will register into the portal. Going into the portal will allow you to email short-term quotes to your clients. As you see here, there's going to be a tab for short-term health insurance. Supplemental insurance is going to be the Latitude plan that I went over. The limited benefit health insurance is going to be the Elite plan that I went over as well. Our Bridge to Medicare plan has its own tab. And then we have the dental and vision tab. And then the Medicare supplement will provide you some information on how to access the supplemental plan that we offer for Medicare through Pan American. Now, keep in mind, the example I'm going to go through is with the short-term plan. If you're in the short-term tab and you are running a quote and you put in a client's age and the system recognizes that they are at least 60 years of age, if Bridge to Medicare is available in that state, you're going to get a pop-up and it's going to remind you to take a look at the Bridge to Medicare plan. So don't get alarmed that you can't continue with, if they've already got a specific plan in mind, you can continue on even if they're over 60. Keep in mind, all of the plans are available from 6 months all the way to 64 and 11 months of age, with the exception of the Bridge to Medicare, which they have to be a minimum of 60 years old to enroll. By entering the zip code, this allows the system to only display plan designs and durations that are available in that area. Once you put in the zip code, you click on See Our Plans. It'll take you over to the next page. It will bring over the zip code. You will enter the date of birth, the gender, and the first name. Where you see the email address optional, I would not populate that field. That is only going to prompt the system to start sending out automated emails to the client, thinking that the client is shopping on their own. That is not going to trigger emailing a quote. There's a separate area for that I'll be showing you. Of course, if you're adding on a spouse or children, this is the page you would want to do that, as it will affect the premium. And then the start date will always default to tomorrow. So if we were live on the system today, it would be showing tomorrow's date, March 11th of 2021. If you wanted to select a date further out, as far out as 60 days, you would open up the small calendar and select the effective date that you're looking for. The duration, depending on the state that you're quoting in, is always, if there are more than one duration available, it's always going to default to the longest duration available in that area. Once you go over to the next screen, after you've entered the demographic information, so this example is in Florida, and you'll see here that we have designed the system that it'll give you 3 top recommended plans based on the demographic information that was entered. Now, keep in mind, what's displaying here is not random plans. These have been selected based on statistics that have been taken by the company. These plans have already been selected with the extended duration. As you see here, the first 2 plans, the Choice and Economy, are underwritten by Companion Life. So they're going to offer a 3x364-day option. And then the third plan is the Epic plan underwritten by North River. So it's going to be a 2x364-day plan. You have a filter on the left-hand side. I highly recommend that you get familiar with that filter, as that will help you narrow down the plan options. As you see here, for this particular client, they have 79 plan options to offer, so it can be a little bit overwhelming. So you want to narrow down your plan choices. Below these 3 recommended plans, you would see the listing of all the plans available. So you would be seeing the 79 plans. There you see are some of the categories that you can filter out the plans on the left-hand side. You're working with a client and want to share up to 3 different plan designs for them to review. You would click on the small box on the top right-hand corner that shows Compare. The banner on the top will open up with the Compare 3 Plans button. Once you click on that, it'll open up to a chart with the 3 plans you selected side by side, comparing the differences. This is not a full screenshot of what the chart looks like. There are more benefits below, and it also allows the client to be able to view the brochure and get more details on the plans. Email this quote. If you click on that, it'll open up a window. That's where you're going to populate your client's information, including their email address. Keep in mind, since you're sending this out from your agent portal, you will receive a copy of the email that's sent to your client. If you want to send out a single quote and you've walked through the plans with them and they've narrowed it down and you have one specific plan that you want to share with them, you would click on the View Details, and then it will take you over to this page. So now we're looking at a specific plan. This example is an Epic base plan. And if you see next to the name, has the RX. That means that you've selected a plan that will include the prescription coverage with the copays. This is the page if you had not yet selected the extended duration. And here you see it'll be up to 2 years of coverage because it is a North River Epic plan. This page will give you the option to add on the supplemental accident rider again, because this is an example of an Epic plan. You can also add on that Latitude Supplemental and the Brilliant Dental plan. And at this point, you would be able to email the quote to the client. But once you click on any of those changes to the plan, it's going to update the summary on the right-hand side. So you see here it went from 364 days up to 728. It's going to display the new premium added on the additional supplemental products that were added on. And then you can email this to the client. Keep in mind, so this is going to be the email that they would receive, giving them the details of the plan. It does a recap of the demographic information. And again, you're going to see this email as well in your inbox as the agent, and they can go ahead and start the application from this point. The underwriting for the short-term plans for Pivot Health are simplified underwriting. So their eligibility is going to be based solely on how they can answer the medical history, the application questions, including medical history question. So if they have to be able to answer no to all the questions on the application. We do not ask a tobacco question. We do not have a height requirement. We only have a weight requirement. So for a female, she can't be over 250 pounds. For a male, 300 pounds. We do accept type 2 non-insulin dependent diabetics. So take note of that. Non-insulin dependent type 2 diabetics are accepted on our plans. We also do not ask for a social security number. The client would only need to be able to respond that they have resided in the United States for the prior 12 months. Once they complete the questions on the application, this is the page where they would enter their personal information. Email address on this page is required, as they will get an email confirmation once they submit the application, giving them instructions how to download their ID card as well as their policy documents. Methods of payment are going to be credit card and ACH only. There is no paper billing option. And at this point of the application process, they still have the opportunity to change the coverage period if they decide to. They would need to make sure that they click on the save button so that it will store the new dates selected. There is no paper application, so it accepts an e-signature once they've read through all the disclosures. And then once they hit submit, it will go through. Keep in mind, they are going to get charged for their initial 30 days of coverage, regardless of whether or not they are selected tomorrow as the effective date or a date further out up to 60 days. They will get charged immediately for that first 30 days of coverage. Going forward, their monthly draft will happen based on the effective date of their policy, because these plans can start any day of the month. So if their effective date is between the 1st and the 19th of the month, their draft is going to happen on the 10th of each month going forward. If their effective date is the 20th to the last day of the month, their draft is going to happen on the 22nd of each month going forward. I wanted to share with you that we have a bonus going on, and we just got notified this morning. As you see here, this has not yet been updated. This bonus was running through March 31st. It has now been extended to April 30th, so you have an extra month to go ahead and qualify. 5 applications is the threshold. Once you hit the 5th application, it will pay back to the very first policy that you submitted. We also have, for those of you who are going to get signed up or who have recently signed up and have not yet sold your first piece of business, this will end at the end of the month. And keep in mind that you can actually qualify for both bonuses. So I would definitely say you take advantage of this opportunity. Here is my contact information I want to share with all of you in case you have any questions or you need assistance. I'm always available to assist you, as well as Sandy and the team at Western Marketing, but I want you to know that you do have someone available here at Pivot to answer any questions you may have. Sandy, are there any questions that you want to go through?
Yes, the question is, did we go specifically over the bridge to Medicare? Because I think I have some people online that did not see the bridge to Medicare product explanation.
Yep, there was a screen. You want me to go back to it?
Would you mind? Because there's one or two of the agents, I don't know, that wanted to see if you could just do some explanation on the bridge to Medicare again.
Bear with me, and I'll get back to that screen. I'll show you what the policy they may have. It's way back to the beginning. So the bridge to Medicare plan is, no, that's okay. Okay, so these are the 3 bridge to Medicare plans. Keep in mind it's available in 10 states. You can't swap benefits on these plans, so it's already pre-selected for you. They are going to offer some prescription coverage, which include co-pays. Maximum benefits on plan 2 and 3 are going to be as high as $500,000. And these are open access plans. Keep that in mind so that there is no network restriction. And when they select the plan, the system will automatically see if whether or not they are young enough to have all 3 coverage periods. Because as I mentioned, if you sign up a client at the age of 63, they will not have the opportunity to have all 3 coverage periods because it is going to drop off the last day of the 64th birthday, 11th month. So the last day of the month prior to their 65th birthday month when they become Medicare eligible.
Great.
And again,
Thank you
you
very
have, does that help?
Yes, that does.
Okay. Any other questions?
The question would be, how does the component of the indemnity embedded on the bridge to Medicare work?
Okay, so the bridge to Medicare no longer has a built-in limited benefit plan. We did remove that earlier on last year. So it is currently just a short-term plan. It is a short-term plan, pre-designed already. And then if they did want the limited benefit plan, they would have to do a separate application for that.
They have to add it, right?
Yeah, correct. Yes. So you were referring to originally when we designed the bridge to Medicare plan, we did have the limited benefit included with it. It was bundled, but they did remove that. So it is separate now.
Great. Well, thank you very much. There's no more
Welcome.
questions. So, thank you, everyone. Do you have any more further information for them?
Nope. Feel free to reach out to me if there's anything I could have, assisted you or provided better information. I appreciate any feedback. And again, feel free to reach out to me at any time if you have any questions or you need help with your portal. I am available.
And I want to thank everyone for participating on this webinar with SureBridge and with Letty Perez. Like I said before, like she said, this is a great opportunity for you guys to take this type of product and incorporate it in your book of portfolio of products that you can offer to your clients, especially for those people who are getting off of a group plan, going into Medicare, and leaving their partners behind. So these bridge to Medicare plans are very, very, very good because you can actually transition those people into Medicare as well. So thank you, Letty, for letting us use some of your time today, and I appreciate it. And thank you, everyone.
Absolutely. Thank you for having me. Look
You
forward
have
to
a blessed
working
one.
with everyone. Thank you.
Thank you.